Today's guest started life as a GP, but has gone on to be CEO of a global healthcare company, co founded a startup, is a speaker at international conferences, and is currently operations director of Tandem Health. So it's my pleasure to welcome today Dr. Katie Baker.
Hey, nice to see you, Tommy.
And you, yeah. Is this your first podcast or are you a seasoned veteran?
Somewhere in between, not my first, but I could count it on two hands. So definitely not a veteran by any stretch of the imagination. Far more comfortable randomly on panels than direct podcasts. So this is going to be fun though.
Yeah, it's like the opposite to me because I don't worry about how many people are listening to this podcast now. But me and Ed have presented at a few conferences where there may be a couple of hundred people. And I don't think I've ever walked up the stairs to the stage so carefully before because it's just like there's so many people watching you. Whereas no one's watching me right now. So I feel kind of relaxed. But I want to talk about your transition from your career because I think a lot of people are going to be super interested with that. But first, I just wanted to show our audience something that currently I don't think that many doctors are using, but I think in the future, all doctors, or in fact, maybe all clinicians will use, and that is an AI scribe. And there's been a ton of buzz around AI, and at Medics Money, we've been using AI in our workflows for several years now, and it saves us a ton of time and allows us to run with a relatively small team and really important part of our workflows. But then the other part of my working week is my role as an NHS GP. And I've just sat there watching for the last few years as the Medics Money uses more and more AI, and the NHS GP role has like no AI until really recently. And I'm really excited to just demo this today because this has massively improved my life by writing my notes for me. So can we just like channel our MRCGP OSCE days and do a consultation and just demonstrate what this is? Because sometimes doctors see this and they're like, well, is this magic or how does it work? So should we just do it?
Let's jump straight in. So we'll kind of show it on the screen now. So for people watching on YouTube, but on the screen, you can see the Tandem interface. So Tandem is a clinician co-pilot with the aim to allow clinicians to focus on care rather than on administration. So on the screen, really simple interface. Actually, one of our super users is 83 years old and really wants to continue writing with pen and paper. So super proud that we've managed to fit into that clinician's workflow. But it's really quite simple. So it can load on any mobile, any kind of tablet or desktop. And there's really one big black button in the middle that you press when you want to start. Just very quickly, there are three ways of inputting information to Tandem. So you can input text if you want to do downstream documents. You can input speech to text. So some clinicians don't want it to listen into the consult. They prefer to kind of get the exact words that they want in their templates. That can be used as we're demonstrating there. But the best value is kind of the ambient listening. So not recording the audio, but producing that document. So Tommy, would you prefer to be the doctor or the patient?
I'm going to put the pressure on you and I'll be the patient if that's okay. I'll be a good patient.
Well, hopefully your listeners don't judge me too much. Although I am an NHS GP, I am locoming at the moment. So you're going to have to forgive me for some of this. So, hi, I'm Dr. Baker. How can I help today?
Oh, hi there. I've been having a few kind of sort of funny feelings in my chest.
Okay, can you tell me a little bit more about that?
Well, it kind of feels, I mean, I thought it might be indigestion, but then the other day it came, it felt like quite serious, like indigestion. I've noticed that sometimes mostly it comes when I'm walking my dog, but when I'm sat down, it's pretty much okay.
Okay, and in terms of where the discomfort, is it in the middle of the chest or is it in any other place that you notice it?
Yeah, I know you mention it. I kind of feel it in my chest, but also my arm as well. Does that make sense?
Yeah, it does make sense. And you mentioned it normally comes on when you're walking your dog. Well, when you kind of, if you're walking, and if you stop, does it go away?
Yeah, actually, that's what I've been doing. When I get to the hill, I get it, and then I stop halfway, and then I carry on, and I seem to be okay. But maybe I have to stop more than I used to now.
Okay. Does it ever come on when you're kind of sat down or at rest?
No, never.
Okay. And when you think about the discomfort, is it painful? Kind of, how would you describe it?
It's a bit tricky, really. Kind of feels like, imagine like someone was sitting on your chest. Like, feels a bit painful. Sometimes I can't really breathe. I mean, do you know what it is? Like, what do you think's going on?
Yeah, I'm just going to ask a couple more questions because it sounds like it could be something to do with the heart, but because there's lots of things that can cause it, it could be to do with the lungs as well. I just want to make sure we're not missing anything. When this comes on, do you get any other symptoms like feeling lightheaded or like you're going to be sick at all?
Yeah, funny you should mention that. The last time it came on yesterday, I did feel a bit sick when it came on, but then I just stopped and it went off again. And I thought maybe I'd eaten some bad stuff for breakfast or something.
Okay. And have you felt your heart beating very quickly or more slowly than normal? It's a strange question, but anything you've noticed there?
No, I don't think so. But what I did remember is that my mum told me that my dad might have had this problem once.
Right. Okay. And did you find out any more about that, whether he had any specific heart problems or angina or heart attacks before?
He didn't really talk about his health that much, but I just know that he stopped walking because of some pains in his chest and he just stopped walking.
Well, sorry to hear about that. Do you have any other family history of any heart problems or lung problems?
I don't think so.
Don't think so. Okay. And do you have any, just in terms of your kind of social history, do you smoke at all?
Oh, yeah.
How many roughly do you smoke?
Well, I used to smoke cigarettes, but it's just too expensive now. So now I just smoke roll ups, which I think might be better for me, right?
Well, we can do a separate, if you're open to it, we can talk about that separately. Roughly how many roll-ups do you have a week?
I probably have like maybe like 10 a day.
10 a day. Okay, that's
Yeah.
okay. We can definitely talk a bit more about that. And how about alcohol at all?
And no, I don't drink.
You don't drink at all. Okay. And any recreational drugs?
And no,
No. Okay. And just going back, so we mentioned what's going on at the moment with kind of that pain you're getting in your chest. Apart from this, are you otherwise well?
I think so, but I don't really come to the doctor that much. I only come if it's serious. And like, I thought this wasn't serious, but then I remembered about my dad. So I thought about
Great.
come see you. Hey,
That you're in the right place. So thank you so much for coming. And do you take any medication regularly?
no, I don't need any medication.
Oh,
I'm pretty fit and healthy.
okay. And any allergies to anything?
No,
Okay. And any other medical problems, any diabetes or other things you've ever been diagnosed with?
no, I don't come here often. So I don't have anything wrong with me because if I don't come here, that means I don't have anything wrong with me, right?
Okay. Well, we'll do a check today and just double check 'cause it's always good to get things checked out and prevent things from happening. So if it's okay with you, I'd just like to examine your chest and take some observations. So for the purpose of the demo, I'm just going to chat out loud. So let's say I listen to your chest. So heart sounds 1 + 2 + 0. So there's no murmurs, no kind of audible bruits. Everything seems okay in terms of the heart. The chest sounds clear. So lungs are sounding clear. In terms of observations, let's say your blood pressure's 108/70, heart rate's 95, sats are 99% on room air, and temperature's 37. So thank you so much, Tommy, for letting me examine you. I think based on what you're telling me, I would actually like to get some tests done today, if that's okay with you. So what we need to rule out here is there being any blockages in the blood vessels that can cause this pain when you're exercising. So I'm going to get you sent up to the emergency department if that's okay. And that's to get what we call an ECG, which is a heart trace, and potentially get some other investigations done just to make sure we can be doubly safe about this, particularly mentioning your dad's history as well. Does that sound all right to you?
Yeah, sounds good. Yeah, thanks.
Okay, thank you. And are you okay getting up to the nearest hospital?
Yeah, don't worry. Someone can take me.
Okay, perfect. Thank you so much. Okay, so we'll just pause. So during that kind of consultation, what Tandem will do is it'll have kind of taken in all of that information. At the bottom of the screen, you'll see some different templates. So we're set up for EMIS System 1 and some other main EMRs that we can transfer this into those. But let's say we look at EMIS to start with. We can add additional text if we want to, but let's go and click Finish and Create, and that will create then the clinical note. Just while it's doing that, on the right-hand side, you'll see a little black round circle with a white square in the middle. That connects to our clinical support team. So over 70% of our non-technical team are clinicians. So if there are problems with language, with terminology, anything that comes up that you're not happy with, they can be supported straight through the system and it can be passed to the technical team if needed. So here's the
Yeah.
note.
So if you're on YouTube, you've just seen the magic on YouTube. But if you're on the podcast, it is like basically what it's done is just spat out a really good summary of everything that we just discussed. It's got the observations in there as well. Like, because lots of doctors have never seen this before, and the first time they see it, they're just like, what is this magic? I mean, it's got the family history, the social history about my 10 roll ups, and it hasn't picked up on any of my kind of idle chit chat, which, patients do. They often meander around the topic and they don't always follow the template. But this is like magic.
Yeah, that's actually one of the really common comments we get, that it feels like magic, but fortunately it isn't the magic that we see normally. It's very real. Just to quickly show some other features whilst we're on, for the people who are watching, we go to once we've checked through, we can go to the very bottom of the screen and there's an add or adjust button. So we can say, can you split the history of presenting complaint into bullet points? Can you add diabetes as a past medical history? Can you add metformin, 500 milligrams twice a day to the drug history? And then we can click send and the note will be updated all in one go. So again, that reduces the need to edit multiple sections at the same time. So again, you can format in the way that you want. And the other thing to notice and mention here is that this is set up for a general practitioner's kind of clinic. Per specialty, we specialize. So for psychiatry, there may have been more mention around more of the social side of things, etc., depending upon that specialty. So once we're happy with the note, we can then, there's again a big black button, follow the big black button. You go into EMIS and choose the patient that you are currently talking to. So again, that's on the clinician. If you had multiple patients open, again, there'll be safety mechanisms to ensure you go and copy this to the correct patient. But with one click of that black button, you can transfer directly over to EMIS. And you can see that going in for those on YouTube right now. So that's all gone across to EMIS. 2 quick points on this. We're currently working on coding, which is super important. And again, we can kind of flip over and show you a quick video of what that looks like, because our main focus for the release in the next couple of weeks is being able to accurately put those observational QoF codes and problem codes into EMIS as well. So you can see again the transfer going over really quickly, and here you can see the blood pressure, the heart rate that we mentioned being transferred directly over into EMIS there. So that's kind of how it looks in practice. So once you're happy with the note, there's kind of 3 main outputs that you get with Tandem. So there's the transcription itself, which is stored for a maximum number of days depending upon the clinic, the note itself, which we've gone through, and then downstream documents. So here we've got things set up like a request for advice and guidance. So you can quickly get, if you needed advice and guidance on this specific, let's say for a cardiologist, again, you've got that just to directly copy over to your letters. And again, we have, let's say for this one, an urgent referral. Again, we can have that done immediately. So all of those documents, including patient documentation, are also ready. Ready.
And this demo we are literally doing in real time. So because you've just generated a referral letter in about maybe 2 seconds. And normally, I don't know what your typing's like, Katie, but a referral letter usually takes me 5 or 10 minutes. And I do them at the end of the clinic because I'm too busy during it. By then I've forgotten some key information. And then I'm like, I can't even remember the stuff that I need to get in there. But it just happened. Like, this isn't sped up. This is just real time happenings.
Yes, this is real time. And in fact, we've had some clinicians who, end up spending about 20 minutes on these documents at the end of the day so that they can do it. This has absolutely changed their kind of life, which sounds really dramatic, but until you try it, I don't think you can see the impact of how quick this is. So yeah, I hope you enjoyed seeing it.
Yeah, I mean, I see it a lot, but I think this has been transformational for my practice. And we just want as many clinicians as possible to experience that magic, because really how this has helped me is I just get to spend more time focusing on the patient and not worrying about the fact that I've got 10 minutes to see the patient, get a diagnosis, examine them, and type the notes. And it just allows me to consult in a much more natural way, like having a chat with them. And then I turn around at the end of the consult and then you saw what it did. It just summarized all the key points. And then that 1-click button into EMIS, that was a thing of beauty. And then the coding might seem like a trivial point, but we were saying beforehand that from my point of view, things like blood pressure being coded means that they pull into the trends and it picks up for QoF. So that could save me an appointment to measure this patient's blood pressure for QoF. So the coding side of things, I think, really exciting as well. But, just try this. If you haven't tried this as a clinician, you can try Tandem for free. The link is in the description. And the setup is so easy and you can get up and running. But maybe at this point, if you finish the demo, we should talk about a few things you need to do before you just start using it on patients, because there are a few kind of things that we need to cover off.
Yes.
Yeah.
So we kind of really take clinical safety, trust, and IT seriously at Tandem. So in terms of your clinic, you can sign up and give it a go. If you're using it on patients, there's a couple of things we do. We get a data processing agreement, which just ensures that you're able to have those interactions as per your clinic. And we also provide all the documentation needed for your clinic, whether that's the DPIA all the way through to the DCB documents. we're fully accredited to run across the NHS. So what we normally advise is talk to someone who has decision-making capabilities at the clinic, if that's the partner, or if you're a PCN level, we also roll out across PCNs and federations. Give it a go, but make sure we can support you with the documentation that's needed for those parts as well.
Yeah, in a sense, the fact that it's so easy to get up and running is you just got, if you're going to use this on patients, you need to do what Katie just said. Absolutely. But there's nothing to stop you. Like when I first started demoing AI scribes, I just used it like on myself or with like friends, not with patients, just to see like, is it real? And
Yeah.
then I realized it is real. And then I need to move to the next step. So you could just try the demo with Tandem for free, no worries. So that's like the data thing covered off. If I'm like in my GP partner role here, my next question, perhaps before data, but maybe after data in terms of priority, how much is it going to cost me?
Yeah, so it depends on kind of who we roll out with. So if it's on a license basis, that's sitting at about £69 per license per month at the moment. But we do, if we're rolling out for the whole clinic or across a PCN, that's much lower. And we do it on a per patient price, which is, it is pretty affordable, we're finding, for rollout across those areas. And as you mentioned, we do have a kind of free period, because what's really important for us is that clinicians at least get to try this, test it, and we take all feedback really seriously because we're building with clinicians for clinicians. So give it a go and let us know what you think, and we can work with you on the pricing for your area.
Yeah, and I think that's one thing that maybe historically GPs aren't that good at is they see the upfront costs, but you got to back that out in terms of hours saved, staff time saved. And at my practice, one of our admin staff, in fact, two of our admin staff have retired now in the last few months, and we're not replacing them because we just have way less admin for clinicians, way less admin for admin staff. I mean, you just saw what it did, and just think about how that trickles down into, secretaries and other roles that you have. So you just try to back out the time savings in terms of, well, once you know what an hour of clinician time costs you, which a lot of practices don't, but if you want to work that out, you can, and I encourage you to do so. You can back it out from that point of view. So that's the cost. My next kind of question a GP partner head on is like, do I need to buy a whole load of new microphones or cameras or anything?
No, it's a really good point, because actually how this technology works is it captures the audio, so it doesn't store it, but then it translates that into the text that we saw. And it's really important that's accurate at the beginning. So what we do is, for any clinician or group that wants to use Tandem, we ship them the kind of tiny little puck microphones, which can be plugged in. And again, when looking at areas we've rolled out across, this hasn't been an issue in terms of that hardware being plugged in. And it really allows you to capture the audio, even if you're at the bedside with the patient doing the examination that we mocked up, Tommy. You can hear that very clearly. You don't need multiple microphones or anything. If people are working on laptops or phones, those microphones are normally good enough, but we always do a test to make sure that's set up properly so you get the best service possible from Tandem.
Yeah, we have a satellite clinic where everything is worse. So the echo is worse, the technology is worse. It's like our hand-me-down computers are there. I've used it there. I would never consider recording a podcast there for sound quality reasons, but actually it works pretty well. So I haven't needed any extra stuff, but there's a plan for that. And then I guess having implemented these kind of things at a practice level recently, it can be a little bit frustrating at getting sign off from the relevant people. What are your kind of tips on working with your, PCN or your IHB or ICB or whatever, like, because that is really important that you get this signed off before you just start using it, even though you're going to be very excited to get going once you've tried it.
Yeah. So we really want to take the heavy lift there, because we are rolling out. So we're now across 22 of the ICBs. We can either advise you that it's already been signed off within that area, or if we're put through to, let's say, the DPO or someone who's running that sign off within your specific region, we can take on the lift of providing the documents that you need, including kind of templating for, let's say, the DCB 0160 that practices also have to put out with these technologies. So we're here to kind of support and make that implementation and onboarding as smooth as we can for you and the clinic or the area. So put that on us. We can help.
Awesome. Okay. So I kind of introed you at the start that you started off life as a GP, but you've morphed into this really amazing role now. So can we kind of get a rewind, maybe starting on how you came to work at Tandem and then backing it out from there until eventually we get to when you did your MRCGP? I mean, you did a great consultation. I think that's the MRCGP pass, no problem. The patient was a little cantankerous, but you dealt with him quite well. But how did you get to where you are now? Because it's not that common, but maybe it's getting more common.
Yeah, I think thankfully it is getting more common. Well, I have to say to start with, my career was not planned. It kind of happened. And I guess what I really did was just follow what's important to me. So when I trained as a GP, I'm sorry, I'm not going backwards from Tandem, which you wanted me to do, but forgive me. I always actually did neuroscience and thought about neural networks and how could we use patterns and data at scale to really improve healthcare. So qualified as a GP and then ended up doing some clinical leadership work in urgent care, really getting kind of my feet stuck into how to improve systems. And then really naively took the path into health tech back in 2017, 18, which most people thought I was crazy doing, including my parents who were just like, what are you doing? What are you up to? And that really was triggered by the fact that it takes a long time within obviously the NHS for reasons to actually do any innovation at all. And it certainly was at that time. So subsequently worked across probably 6 different health tech businesses in all different kinds of roles, from operations to product to regulations, taking products into health systems across the UK, Europe and the US. Fast forward to last summer, was running a women's health business, mainly focused out of the US, but had components in the EU and the UK as well. Kind of exited from that in June, not a life-changing, but allowed me to think, oh, I'm going to go and hike in the mountains and take some time out from the startup scale-up journey, and got approached by the investors at Tandem, which I am hugely grateful for. But at the time, really had to try and convince myself why I shouldn't bring this product to market in the UK. Really grateful that I did, because certainly as a GP, had tried some of the other scribes at the time and just thought about the impact it would have on other healthcare professionals in the NHS. Now is a critical time, as we know, the cuts that are coming to support the system, which is always kind of deeply aligns with my mission to support our health system alongside the other international health systems. So ended up joining Tandem in October of last year and have kind of just seen rapid adoption, to be honest, in the UK that I wasn't expecting so much at the beginning. So Director of UK and Ireland for Tandem, and absolutely thrilled to be hopefully improving the lives of both clinicians and patients from what we're seeing in the UK market.
Absolutely awesome story, and definitely on fast forward there. I think like a lot of people might relate to your initial kind of pathway. And I'm really interested in, like, I always think like just getting started is the first step, like just
Mm,
taking the leap for me and Ed to start Medics Money. It
mm,
took us absolutely ages, but once you get started, it's easy. So
mm.
you went from like a GP that was kind of had these outside interests, and then you got your first role in the health tech.
Yeah.
Slow that bit down for me. And like, imagine I'm getting a role. I'm not, I'm happy
Yeah.
where I am, but imagine I'm like, I'm interested in health tech and I want to get my first role. How did you do that?
Yeah. So I think often clinicians forget how many transferable skills they have, even if you've come straight out of, medical school or from the foundation years. There are so many skills that are transferable. What I did, and this isn't to say this is right for everyone, was really look at businesses that I thought really aligned with what I wanted to achieve personally. So my first company was looking at preventative healthcare, and I really was like, we need to sort this out. What can I add to that business? And I actually then approached that business and managed to negotiate a 3-day a week, 2-day a week, I think it was initially, with 3 days of GP initial operations role, just to kind of get into the health tech world, because it is so vastly different from kind of medicine, and learning about businesses and different functions was super valuable at that time. But I basically looked through a list of companies I thought were doing something I was aligned with, and then directly kind of approach those businesses to say, look, I'm really interested in this kind of work. What do you think? And if not, can you point me in the right direction? I think now, obviously, we're almost 10 years down the line from when I did that. I think there are some fantastic groups online. There are fantastic kind of people putting out job opportunities as well. I know that's something you're looking at doing soon as well. So really using network. And I also like to support people. So if people on the podcast ever want kind of support, happy to have quick chats with people on how I made that move. But really, I didn't look back. I kind of just said, I want to try this, and this is what aligns with what I want to do. And, keeping focused on that and being confident on what you have to offer.
Amazing tips there. And do you want to put in the cheeky job advert, or have you recruited now?
Oh, so we do have, yeah, we've had, I think, 250 applications so far for the job, but we are hiring at Tandem. So we are specifically looking for commercial partnerships, looking at secondary care and parts of primary care and also medical operations. But we're looking for people specifically with knowledge in LLMs and prompt engineering as we develop products. So, yes, thank you so much for that, Tommy. Always
That's all right.
glad to hear from people because we're growing so quickly. So,
Yeah. Happy to hook our audience up with great companies. And I know that lots of people want to get in the space, but you made it sound quite easy, but I think it might be quite hard. Okay, let's just go like, also, I love it. Like you said that there was no real plan. You basically just followed your passion, which following
yes.
your passion can be terrible advice, but
Yeah.
essentially that's what me and Ed did. We just followed our passion for helping other doctors improve their finances. And that's
Yeah.
how we ended up here. So
Mhm.
I think following your passion can be a trap, but it can also open up new doors. And if you're passionate about something, it makes
Mhm.
it a lot easier. I don't know. What do you think about following your passion, trap or good idea?
I think there's a balance. I think when you first get into something, because, if you're going into a startup environment, again, it's kind of intense working patterns. You need to really enjoy kind of what you're working on to be able to survive in that kind of environment, I would say. So I think there's an element of that, but certainly having a broader idea of what do you want to get out of this. So for me, there were certainly elements of, okay, this aligns with my passion, but what do I want to do to learn and grow in my career, and what do I think this gives me for these types of roles really helped as well. So I think a balance of passion plus kind of strategic thinking around what do I want to learn, what's going to make me happy, and like what would I like to do with my time? Because I keep hearing at the moment this thing, Tommy, which is like the piece around you become most like the five people you spend most of your time with. It must have been said so many times over the past few months. It's coming up all the time. But work's one of those things, right? For those people who need to work to make money and provide for their families, etc. It's choose your work if you can, if you're fortunate enough to be able to do that.
Yeah, definitely. It's just like passion with purpose is how I try to
Yes.
think about it. Like, I'm really passionate about coffee. I'm not about to do a coffee startup. I'm really passionate about helping doctors improve their finances. I may
Yeah.
have some unfair advantages there that other people don't have. I may have some co-founders that have exceptional unfair advantages, and I might have some insight into the marketplace. I'm like, okay, well, coffee sounds like a bad idea, but maybe makes money. It just might work. So
Yeah.
passion with purpose. And yeah, I think like that you become the sum of the five people you spend most time with is one of those cliches, which I didn't really understand until it happened to me. And you step outside the kind of, there's a kind of like a path in medicine, like you do F1, F2, you go straight into registrar training, you do registrar, you do the exams and you become a GP or whatever your respective path is. And then when you
Mhm.
step outside that path, you suddenly get surrounded by people who are like, "Oh, what are you doing after F2?" "Oh, I'm just going to do a startup." And you're like, "Sorry, what kind of crazy idea is that?" And then they tell it that you the idea, and you're like, "Actually, that isn't crazy. Maybe it's crazy to go straight from medical school to F1 to F2, then straight into a
Mhm.
registrar job that I'm not really that sure about. Maybe I should just do that crazy thing." So, yeah, I think you're saying like the power of community, which once you
Yes.
get into the network, it suddenly crazy ideas like become kind of maybe more less crazy.
Yeah. I think network's so important. And I think right now there's so much to do in healthcare that the more clinicians that we can get engaged, even alongside clinical work with, innovation and transformation in healthcare to support, the growing population and what we need to do to transform healthcare from where it is now to what we want it to be is so important. And the networks that are created can really help guide people in and certainly create connections, the people you need to talk to. So they're super valuable. They're popping up. There's quite a few key ones. Yeah.
Yeah, awesome. Okay. Tech startups need more coders than clinicians or don't need clinicians. Discuss.
Are you trying to make me angry?
I'm just saying like things that I see online, which is just like a healthcare startup where there is very minimal clinician involvement. And then some of the things that they do, you're like, why did you do that? And it's like, oh, because you don't have any practicing clinicians on your team. So you mentioned that you're still locoming, right? And you did
Mm.
an amazing consultation earlier. So let's go down that rabbit hole.
Well, I have very strong opinions, which I think are weakly held, but maybe aren't weakly held here, which is I don't believe a health tech company is a health tech company if it doesn't have people knowledgeable about the health system or who are actively in the clinician space in there. I think it's really important because you can produce some great idea and solution, but if you're not going to be able to implement or adopt it amongst the people that need it, I think could be a waste of time. So I'm really keen that clinicians are more and more involved in these businesses to drive how they're solving the problem for themselves and in part for their patients to make them more successful. But that's just my opinion. So, I don't know what you think, Tommy.
Yeah, I promise I'm not just collecting clips for the shorts here to boost the engagement of this, but my next one is that doctors need to learn to code in order to be useful at a tech startup.
No, well, I have a very basic level of coding, but I use it not at all and haven't for many years. And I thought I needed it, which is why I went down that route so early on, just to be able to understand technical language, etc. But you don't actually need that at all. I mean, there are some really valuable clinicians who can do both, but absolutely not. You don't need any technical knowledge to do that. And actually, as I said before, we have so many skills as clinicians in terms of strategic thinking, critical thinking, like really understanding what we need to do to get value to ourselves and to patients, that you don't need to be able to code. Plus, there's fantastic tools. I'm not going to get us on to like AI tools and coding tools because we could be here for a long time. But there are so many tools out there which are kind of no code at the moment as well. So even if you're a clinician wanting to start a business, gone are the days, I think, where you need a CTO alongside you, a chief technical officer, to be able to build those companies. So we're at this inflection point, I think, with technology and healthcare, which is super exciting. Yeah, and just want to empower and enable people to get on board.
Yeah, the rise of no code is like really exciting if you're a non-technical founder like me. And I think like what you said is like you need to understand some like what is possible, how could that work from an architecture point of view, what is technically possible, and also trying to work out you might want this feature, but it's going to cost this amount and it's going to be super difficult to build. So like how much do you really want that feature? And if you kind of have some insight into that, you can take some shortcuts. But yeah, I think that's a really super interesting take. And then final question, 10 years time, it's an easy one. What's health tech going to look like in 10 years time? Like, is AI going to replace doctors, and what's coming down the pipeline?
10 years, 10 years seems like it's not that much time, but it kind of terrifies me if I'm really honest. I think we will never replace clinicians. Like, I think there are so many cases that both of us and hopefully many on the podcast listening or watching see regularly. There are people that will never be able to be supported through digital means only. And there is so much to be said about human to human connection and interaction. Even if we just took the mental health care group, like managing all of those people digitally just seems completely wrong. But what I do think is going to happen over the next 10 years, and I think there'll be a lot happening in the next 2 to 3 years, is really optimizing healthcare. So offloading the operational administrative tasks. And then what we'll see is like agentic pieces doing additional things so that clinicians can really focus on the human interaction. And I really see it as human plus technology creates kind of the best outcome. And some people have these wild ideas like you were mentioning before about self-driven cars in a previous discussion we had, of like going into these clinical diagnostic centers, which again are being cut by the government, but where you'd see like a virtual AI person first before you even got to a GP. But I think if we're realistic about it, there are some very simple things we can do to really transform healthcare. And that's why I think focusing on the administrative piece as we build out the validation for the clinical AI piece is so important. So I think we'll see huge transformation. I think it will be human plus technology. I'm excited for what that looks like and hope to be involved in it in some way.
Yeah, I mean, it's already here, isn't it? It's like one of my goals in medicine is to reduce decision fatigue. So, I have to make hundreds and hundreds of decisions a day. And some of those decisions could be offloaded to the AI. For example, writing notes or maybe filing blood results or something. Is it going to do 100% of the work? No, but it just leaves my brain clear to think about the important decisions and takes away trivial decisions from me. And I find the analogy with self-driving cars, I've got a car which self-drives in inverted commas. It does nothing of the sort, but it takes away like what speed I need to go, what lane I need to be in, where do I navigate, like takes away all those trivial decisions. So when I get to my journey, it hasn't self-driven me there, but I just feel way better, like because I made less decisions. And I'm already noticing that in healthcare that I feel less decision fatigue, because I
Yeah.
haven't looked at 100 normal HbA1cs and had to spot the one abnormal one. The normal ones have been taken away, and then there's just one abnormal, and I'm like, oh, cool, what to do with this one? So
Yeah.
yeah, I'm just really excited, and that's why I'm excited that we could bring this to the audience today. So to get a trial of Tandem, I'll
Mhm.
put the link in the show notes where you can get the free 7-day trial, and the guys and girls will look after you as well. And your website is just Tandem Health. What?
Yeah, we can include that in the comment as well. So I'll send that over to you.
Okay, but tandemhealth.com.
AI.
Oh, .ai. Very
Yeah.
nice. Okay, brilliant. Thank you so much for your time today,
Mm.
Katie. And really look forward to as many people just trying out this and just try it out, like we said, and see how it works for you.
See what you think. Get in touch. And thank you so much for your time, Tommy. It's been an absolute pleasure. Thank you.
Absolutely. Great to have you on. Thanks.
Thanks.